Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing one additional case of COVID-19, bringing our total to 263. The total number of deaths related to COVID remains at 6. As of this morning, 7 individuals are hospitalized. Of that, 3 are in intensive care. 196 individuals are listed as recovered. There are 61 active cases. As of yesterday, an additional 786 lab tests were performed. This brings our revised total to 22,172. As announced last week, we've expanded our testing criteria. All symptomatic workers or volunteers who are still going to work outside of home. This includes people working in construction, transportation, manufacturing, grocery stores, all daycares, or any other critical businesses. If you're symptomatic, you're eligible for testing. Any symptomatic person who lives with a healthcare worker, or first responder, or worker in a congregate setting such as a correctional facility, shelter, long-term care, or residential facility are also eligible if symptomatic. We have been seeing our testing numbers go up. And so I think this message has gone out. We're going to continue to message that. People with symptoms, even if they're mild respiratory symptoms, and you think you fit our criteria, please call Health Links for further advice. Our criteria has long included those who have traveled outside of Manitoba in the past 14 days, those who have been in close contact with a confirmed case, all healthcare workers, lab workers who have worked with COVID-19 tests, or individuals who live or work in the north or a remote isolated community, a group setting such as people living in a correctional facility, shelter, long-term care, or a residential facility, or in a remote work camp. There's been some questions on whether these criteria would include individuals such as food inspectors or similar occupations, and the answer is yes. All those people who are currently working who are symptomatic are eligible for testing. We have been able to increase that testing capacity, so we're encouraging those who fit our criteria to be tested. We remind Manitobans that there should be no non-essential personal travel. The advice remains to stay home for the most part, leave for essential reasons. And this includes Manitobans regardless of where you're living. This virus is in every region of our province. For Muslim Manitobans celebrating Ramadan, again asking that this year you choose to celebrate differently, connect virtually, avoid large groups. We're trying to diminish the transmission of this virus. And so this year, continue to celebrate, and all my best wishes to you, but please do so virtually. The social distancing strategies to stay home for the most part, this includes messaging around going to the cottage. Should really be only headed there for essential reasons. If you do travel and you do need to go to a cottage, you should ensure you're only traveling with family members, that you're not visiting with others upon arrival. You avoid stopping for gas or other supplies along the way, and only visit local healthcare providers for emergencies. So I want to continue to thank Manitobans for their efforts at flattening a curve. We've been able to avoid significant community-based transmission or outbreaks in high-risk settings such as personal care homes. We've been working to continually to increase our testing capacity. We've expanded our testing criteria. We've expanded capacity within our healthcare system. We're working to continue to protect our personal care homes. We're moving to limit the amount of workplaces people working in personal care homes are able to work at. And this is all allowing us to look to the weeks coming to gradually lift some of these restrictions that we've had on Manitobans. We're going to do so very cautiously, very slowly, and follow our numbers very closely. But we're going to look to ways to safely reopen the non-essential businesses. Others will remain closed, but we'll do so in a phased approach. These changes will be introduced quite slowly and cautiously, as I say. We're going to follow our numbers to ensure limited transmission of the virus occurs. And our plans can always be subject to change based on the numbers that we see. But I think that, again, thank you to Manitobans for your efforts. Thank you for visiting our website, manitoba.ca/COVID-19. And we've been able to affect the transmission of this virus at this point. We need to be cautious. If we loosen up too quickly, we can see these numbers again climb. So encouraging all Manitobans to stay with the current public health guidance. As we move forward, like I say, we will be able to loosen some of these restrictions, but we're going to do so very slowly, and we're going to rely on Manitobans to follow advice with that as they have been up to now. So thanks again, and I'll pass it over to Lanette.
Thank you. Good afternoon, everyone. I'm Lanette Siragusa, Chief Nursing Officer from Shared Health. I wanted to start today by thanking everyone who continues to support our healthcare workers in various ways. The Canada Post workers paraded around the Grace Hospital a few days ago to show their support, and we've had many restaurants and organizations continue to deliver meals and feed our staff at different sites. We had Earls make a few stops at Health Sciences Centre. Maple Leaf Foods dropped off some gifts for the staff at Bison Drive testing site a few days ago. So on behalf of healthcare workers, I want to thank everyone for their support and let you know it is greatly appreciated. The absolute best way Manitobans can support healthcare workers is to continue doing what they've been doing to flatten the curve. And that means staying at home when you can, certainly when you're sick, using social distancing measures when you need to go out, and practicing good hand hygiene. And I wanted to talk to you today about surgery. As we have mentioned before, there's going to be hills and valleys when it comes to dealing with COVID-19 over the long term. So a month ago, we began suspending non-essential surgical and diagnostics procedures to ensure that the healthcare system had the flexibility to respond to a rapid increase in the spread of the virus. We know that waiting for procedures can be very stressful on patients, and we know that there are postponed cases that cannot wait any longer. So we have always been planning for the time where we need to ramp up our surgical activities. And this is a careful balance of clinical assessment and system capacity. And we know this will be an exercise that we have to repeatedly go throughout this pandemic. Over the next week, a number of facilities across the province will begin to increase their surgical capacity. This includes Health Sciences Centre, Pan Am, St. Boniface Hospital, Concordia, Misericordia, Victoria, Boundary Trails, Selkirk, and Brandon. This is a one-week ramp-up plan that will see significant increases in neurosurgery, vascular surgery, and thoracic surgery. As well, it will include urgent cataracts, orthopedic, and cancer cases. Surgeries will be scheduled for the more urgent cases first, and all necessary precautions will be taken to protect staff and patients from the risk of COVID-19. This includes point-of-care testing, appropriate PPE, and limiting the number of staff who are in the room to those who are essential for patient care. Patients will be contacted directly about scheduling their surgeries starting on Monday, or the surgeries will increase starting on Monday, so they'll be called before then. And in the meantime, clinical experts will continue to assess patients on a case-by-case basis. Visitors. So the visitor restrictions have now been in place at our facilities for a number of weeks, and we have talked about the efforts communities are making to visit from the outside. But separation from a loved one is not easy, and while In-person visits are restricted. Sites and staff are doing their best to keep families connected with their loved ones. Many of our intensive care units are preparing to or have already begun to use technology to offer video conferencing between patients and family members. If you have a loved one in intensive care, please reach out to your care team to explore your options to connect. While this is beginning in our intensive care units, we do hope to use this technology to allow for virtual visits and connections in other areas of the health system. So we look forward to sharing more with you about this soon. PPE, we had the opportunity this week to help some hard-hit provinces with the procurement of vital signs monitoring. These monitors, they track vital signs such as blood pressure, pulse, temperature, and oxygen saturation levels. We had ordered 120 of these monitors some time ago in anticipation of higher surge demands. And while Manitoba is still relatively early in its fight against COVID-19 and those surges have not yet materialized, we will continue to prepare. But our situation in Manitoba means that we are able to redirect these monitors to facilities that need them now while we wait for those replacements to arrive. So we have temporarily gave our monitors to Mount Sinai Hospital in Toronto and the Jewish General Hospital in Montreal. They will be getting approximately 50 monitors each. And we expect to receive a replacement order of monitors in approximately 4 weeks. And finally, I want to remind everyone that several community testing sites are open on the weekends throughout the province, and there's no need for you to wait until Monday if you feel you need to be tested on a Saturday or Sunday. As Dr. Roussin has noted, we have expanded testing to include all symptomatic workers or volunteers at workplaces that have been identified as essential services, and any asymptomatic person who lives with a healthcare worker, first responder, or worker who is employed at a correctional facility, shelter, long-term care, or residential facility. A full list of locations and hours of operations can be found online at manitoba.ca/COVID-19. And with that, we can open the line to questions.
Thank you. A reminder to our reporters online, you will have one preliminary question and one follow-up question to begin with. First up from CTV Winnipeg, Michelle.
Hi, it's Michelle Growing from CTV Winnipeg. I'm wondering, because we're heading into a weekend which has gotten really good weather forecasts, can people have people over in their backyards, or what's your advice?
Yeah, so I mean, the advice, the general advice remains the same. You know, the best thing you can do to protect yourself and the people around you and all Manitobans, including our healthcare workers, is to stay home as much as possible. Certainly that can include being out and about in your yard and getting some exercise in, going for walks, but you need to maintain that physical distancing. You know, so certainly not a recommendation to invite people over. If you did, being outside is ideal, and maintaining that 2-meter separation at all times, and then again keeping those group sizes low.
Okay, thank you. And then in regards to the surgeries, Lanette, can you go into more detail as to why we can start increasing the surgeries, and how many more surgeries are we going to be doing?
So that will vary. How many they're going to be doing will vary between sites. So some sites will be They have capacity to do more with their existing staffing, so they're going to open up capacity that way. Some sites like St. Boniface and Health Sciences Center will actually be increasing by 2 operating rooms a day starting on Monday. And it always was the plan. Like, we know that we can't slow down surgery long term. We can slow it down short term, and we sometimes do it during the summer or during Christmas or during a strike of any kind. We have slowed down, but we also know by experience there's only so long we can slow down for before we have to start building back up again. So the day we looked at we have to slow down and ensure there's capacity for COVID patients was also the same day we were planning on how to build up again.
From the Winnipeg Free Press, Carol.
Good afternoon, it's Carol Sanders at the Free Press. I'm just wondering about the surgeries and how much of surgery is being limited, elective and non-elective, by the amount of PPE that we have.
It shouldn't, well, we were using more PPE before, for sure, but as part of our PPE strategy, we certainly have moved more towards disposable. Also screening ahead of time to know which patients are at risk for COVID, and just getting some more clarity. So over the last several weeks, really refining what our guidelines are. So it really, I mean, certainly we, no, it's no surprise we are watching our PPE, but it's not so much that, so much as it's really looking at, originally we did it because we were expecting a surge in COVID patients. We wanted to make sure there was capacity, and we were shifting a lot of resources to other areas like the access or the assessment centers, the testing sites, the staff health. So there was just a lot in motion at the time. So as we go up, we will for sure continue to watch the PPE usage, but that was not that wasn't the reason why we slowed that down. At the time that we slowed it down, we didn't have any PPE concerns.
And for a follow-up question, when is a surge expected, or when should we be peaking? Can you give us an idea of, over the next few weeks, what you're expecting and what you need to see before you find out if there's a peak? I mean, could we be waiting for a peak in 2 months?
Yeah, so it's difficult to know when you are actually at a peak. It's usually you can look back and see when the peak was there. So certainly some of the numbers for this first bit shows evidence of a possible peak here, but we can't confirm that at this point. It's going to really depend on the actions of Manitobans. Because we can certainly see a climb in cases right now if we loosen up too quickly our efforts. So our numbers have been looking like they're in the right direction, and we're at a position right now where we can start to plan on gradually loosening some of these restrictions. But at that time, we're going to pay very close attention to the numbers going forward.
From Global, Marnie.
Good afternoon, Marnie Blunt from Global News. Dr. Roussin, we're hearing of several incidents where people who aren't following the Public Health Act or social distancing measures are being warned rather than being fined. You've had this messaging out for some time now, and I guess some people aren't getting the message. So why aren't we utilizing the enforcement measures introduced and issuing more fines rather than warning them?
Yeah, so there have been some fines issued, and the public health inspectors are certainly taking this seriously in businesses, and so that will continue to occur if necessary. So there have been fines levied, and there's certainly likely to be more, because we're going to take this seriously. And going forward, as we start loosening restrictions, having people adhere to those properly is going to be very vital to our success on being able to loosen up the restrictions. But I think with our numbers show that most Manitobans have been following the advice. And, some may not be fully aware, some may have lost focus possibly. So I do think it's, we want to come out to Manitobans and be there to ensure they're aware of it. But if necessary, we'll definitely issue fines.
Thank you. And my next question is for Lanette in regards to the vital sign monitors. Can you talk a little bit more about why we don't need those here in Manitoba and want to give them to other provinces? And if we do see numbers go up, say next week or before we get that replacement shipment in, are we equipped to handle that?
Yes, we wouldn't have given them if we didn't think we were equipped for a 4-week period. So, and we do want those monitors, that's why we ordered those monitors, but they are part of our strategy. So right now, as you know, these monitors are specific for medicine. They're not for critical care, they're for the medicine beds. And we have about 70% occupancy right now. So we already have monitors for those beds, plus we've also planned for additional capacity, up to 300 medicine beds if we need it, should there be a surge. So we already have monitors for those as well. So it's really planning above and beyond that. So I think we are in a very good position. We would not have given those monitors away if we thought we weren't. And we also are now top of the priority list for the vendors. So as soon as those monitors are ready to be shipped out, they'll be coming to Manitoba.
From the Brandon Sun, Bud.
Hello, Bud Robertson, Brandon's son. You rattled off a lot of medical terms for the non-essential surgeries. For an old layman like me, could you go through what some of those surgeries would be and include like knee and hip surgeries and that sort of thing?
Yeah, sure. So every hospital actually has kind of their own specialties, but then there's some hospitals that do a lot of everything. So if I were to, we've talked about that cancer surgery for sure. Even if they're slow-growing cancers, we want to start getting them done now. If there's any urgent cases, and sometimes that might not be life or death situation, but it can be it can compromise your life, really. So things that cause pain and stuff like that. So cancer surgeries, urgent surgeries, we would look at all realms. So there's lots of specialties of surgery, but the ones I rattled off was neurosurgery. So that's your brain and your spine, vascular surgery, cataracts, obviously, it'll be for urgent cataracts. So people who are incapacitated because of their cataract, they will get done. And orthopedics too. So hip and knee degeneration can cause a lot of pain and immobilize people. So all types of surgery are open to be done. It just really is a case-by-case assessment by the surgeons as to how do we prioritize and start getting these done and through the list and really we want to make sure we're minimizing the impact to wait times. Does that answer your question, Bud?
Yes, thank you very much. I don't have to call it my medical book now. Regarding those, are the bulk of those remaining in hospital? Are these day surgeries? Is it sort of split up? I'm just wondering if the beds are going to be filled with patients or if a lot of them are discharged after their surgeries.
Yeah, that's a very good question. So it depends on the surgery. So cataracts almost never stay overnight. So those should be day surgeries. If they do laparoscopic procedures, it depends on the anesthesia they get and the way they do the procedure. But lots of the general surgery and urology surgery can be done as day surgery. And then there's others that are much more invasive or the way they put you to sleep may require you to stay longer just for observation. So those might require some stay in the hospital.
From CJOB, Diana.
Good afternoon, Diana from 680 CJOB. Question for Dr. Roussin. How quickly can someone get really sick with COVID-19, kind of to the point that they would need immediate hospitalization. I know we talked a lot about obviously not wanting to put a burden on rural healthcare systems if someone's going up to cottage country and gets sick, but if someone were to head to their cottage in Kenora for the day to maybe check in on their property, of course, Kenora has very few ICU beds, would it be possible for them to get sick enough, presuming they had no symptoms upon leaving Manitoba, that they would need medical treatment kind of in an urgent kind of way?
Yeah, it's a tough question to answer. There's more illnesses than COVID. Many of those can come on quite quickly. So COVID usually begins with relatively mild symptoms, but someone who had significant underlying medical conditions could get sick quickly, I imagine. A lot of people who require hospitalization have been sick for quite some time with COVID, but there's lots of other reasons that urgent medical issues come up as well. So it's not only about COVID, it could be any number of medical conditions that can come on quickly.
Okay, and as a follow-up, does the testing that we're doing now give the province accurate and enough data to share with Health Canada to get the best information sort of on where we've been with the pandemic and where we're going? We're kind of hearing from a lot of experts that we still aren't where we should be in testing and that widespread testing is needed. What are your thoughts on this? Manitobans have kind of been asking this quite frequently.
Yeah, I think, well, if we look at our numbers nationally, we're sort of in the middle of the testing volume. I think there's, as far as metrics go, the number of tests done is not that significant of a metric. Things like the positive test proportion is significant, and Manitoba's is one of the lowest. So those are the type of numbers that we follow. So certainly we want to be able to test appropriately, and we've expanded our criteria quite recently, and we're looking to expand that again if we don't see our capacity being reached in the lab. But to pay very close attention to just simply the amount of tests done is not a great number to guide our response.
From the Winnipeg Sun, Scott.
Hi, Scott Billick here, Winnipeg Sun. I guess my first question is to Dr. Roussin, and kind of along that same vein about testing, but more just looking at yesterday's test, and you said earlier just about how maybe the message is getting across. Now, do you know that for certain? Like, do you know the type of people that are getting tested, whether they're healthcare workers, the fears of people going to the cottage, what that is? And I think you said in the past that, stopping and overwhelming local health centers that are smaller and maybe ill-equipped to kind of handle it. But is there anything else other than those, or are those really the main fears of people traveling to the cottage?
Yeah, I mean, I think the overall message has been that if you can stay home as much as you can, that's your best way to protect yourself and others. And so that includes, not traveling anywhere, and that includes the cottage. So when you leave, then there's just a number of steps along the way that increase the risk. So like we say, if you travel only with the people you live with, if you go directly to your cottage, if you don't interact with anyone else, you don't stop for any goods or services along the way, you don't use health care along the way, then this is a fairly low risk. But that's a lot of buts. It usually will require an extra stop at the gas station, an extra grocery store visit, and possibly a visit into a neighboring town. So those are the type of things that we really want to avoid. So I think the general message is right now is to stay home as much as you can, and so that's the best advice.
From CBC Radio Canada, Ezra.
Hello, Ezra Bullet-Cousineau from Radio Canada. This morning, the mayor, Winnipeg's mayor, Brian Bowman, said that his office received some calls from people asking about, the methods proposed by the U.S. President, Mr. Trump, about ingesting disinfectant. And my question is actually more about here in Manitoba. our Health Links lines, have they received those kind of calls asking about, like solutions that are transmitted in the different medias or do you have that? Do you have a lot of those disinformations on your lines?
Well, I can check with HealthLinks. I don't usually get that type of detail, but we can definitely look into if they're getting any inquiries from the public on that topic or anything. We can actually give you a general idea of what kind of questions come into HealthLinks. So allow me to get back to you on that, Ezra.
And then we would just, clearly give the message to not ingest or inject any disinfectants. Followed only the advice of a healthcare provider on these things. So hand washing very frequently, but do not ingest or inject any disinfectants.
From CBC Manitoba, Bart.
Hi, sorry, I was just muting. I was laughing for a moment. Pardon me. Dr. Roussin, the Premier has said that 2,000 tests is the target. You said you'd like to be able to get to a place where you could test all symptomatic people. In the course of a normal summer, how many Manitobans would have cold or other regular respiratory symptoms at any one given time?
Yeah, so there's lots of variability with that, and some estimates are up to 10%. So it's certainly not going to be 10% per day. With that. So when we calculated the around the 1,500 to 2,000 mark to have the capacity to do that, that gives us about close to 1% of the population per week, and we thought that would give quite a good sampling.
Thanks, very helpful. Further on the Saskatchewan plan that came out yesterday, one of the interesting facets of that is a date to start, that makes sense, but then a date 2 weeks later to do other things. You have spoken repeatedly of monitoring case numbers after there's a reopening. When your plan comes out, are you going to have hard dates in there?
Well, I think our plan will probably have hard dates to reassess. So it's going to be a guide, and so like I said, our plans are open to revision. It's going to depend on the numbers, and so there'll probably be some dates on there. We want to ensure that Manitobans know we really want to have a phased approach. We really want to loosen these restrictions as we can, and we want to provide Manitobans with some dates that they can look forward to possibly some loosening.
From the Canadian Press, Steve.
Steve Leonard from the Canadian Press. I have a question about the turnaround time for test results. Now that the lab is taking on more tests, almost 800 yesterday, what is now the average turnaround time for a positive result, which I understand would be the priority, and for a negative result?
So there's a couple of things in that question. So the results are come out the same at the same time for the most part. Sometimes using a pooled sample, they would the positives could be delayed a bit when they have to depool them. But the mean turnaround time at the lab was 27 hours yesterday. The total turnaround time, the mean total turnaround time was about 2 days. And so that's, from sample to get to lab and then to lab to process it. Now, that doesn't include the time it takes to contact people. That's a different measure. That's a tough one to follow.
Yeah, sorry, that was my question, was the results being given to the person, which would include that notification time.
Yeah, it's difficult. So as soon as public health will get a positive lab result, they're on the phone trying to contact that person. but it's not something that's recorded necessarily on what that exact time is from the time the swab was taken. And then a negative result takes a different process. They're called out through through Dynacare right now, so it's two different processes.
Okay, my follow-up question is about the public health orders. They expire at the end of next week. And given the numbers that we're seeing, are you needing to loosen them, or at this point?
Well, we're working on that plan, and so next week we're going to be discussing more of the details of that plan. So there'll certainly still be public health orders that will be in effect and extended. What they will look like, it's going to depend on what our numbers look like through next week, but we'll be able to describe a more detailed plan next week.
At this moment, we're going to go back to Ezra from CBC Radio Canada for his follow-up.
Thank you. The line I've cut. I wanted to know concerning the equipment, the monitors that are sent to Montreal and Toronto. I wanted to know how those particular hospitals were chosen. Are you in direct contact with the hospital, or are some people putting you in touch, or are you going through the Quebec health authorities?
No, I personally am not in direct contact, but there is a federal provincial table that meets very regularly and identifies where there's challenges, where there's learning, so that we can really have a pan-Canadian approach to it. So I believe it came through that table, and then before any decisions were made, there was discussion among the health system and through incident command if that was something that we could support. And so after some discussion and analysis, we said, yes, we could support that short term, knowing that we would be the top priority when the next shipment comes.
Thank you. We have some time left, so at this point we'll open it up to any further questions from our reporters. Please proceed.
Hi, Marnie Blunt from Global News. Lanette, do you have a cost for these vital sign monitors that you're able to share with us?
Yeah, I do. They're about $3,000 each.
As we talk about the excellence plan opening up, I'm just wondering if you can talk about, I've been hearing from parents wondering about daycare, like people who are non-critical, non-frontline healthcare workers, wondering about daycare and what's going to be the situation with daycares. When will they be able to open for non-emergency, non-frontline healthcare workers?
Yeah, so we're going to have those detailed announcements next week. So I don't really have any details to share about the reopening plan. We're working on that. We're looking at all those type of things. So next week we'll be able to have a detailed plan for you.
Okay, and it might include something about daycare?
It's we're going to have a pretty inclusive restart program. So we'll I won't release any of the details right now. They're still being worked out. So next week we'll discuss that.
Lanette, it's about, you mentioned earlier about opening up surgical suites for major surgeries at some of the hospitals in Winnipeg. Do you know what's going to be doing in Brandon with regard to that?
I think we would have to talk to Brandon. So they do quite a variety of surgical cases in Brandon, including the orthopedics, the hips, the knees, and cancer cases. So it would really be dependent on which patients are waiting for what types of surgery to determine where is the urgency and how do we get those patients in as soon as possible. So I'm not sure exactly how they're going to approach it, but I'm certain that they would have a surgery and anesthesia team looking at the risk factors and the urgency of each case, and then making sure they work through the process to get done.
Great, thank you.
Dr. Roussin, Spartan Cubic here. Is there any, because of the low numbers in the first few weeks of this pandemic here, are there any concerns about Manitoba being unusually susceptible to a so-called second wave?
So we need to prepare and expect for other waves of this virus, or we're going to need to deal with this virus for quite some time. And so the things like immunity to this right now, we still don't know a whole bunch about it. So we need to continue to take a lot of precautions going forward. We don't know what a second wave may or may not look like. But it's becoming clear that we're going to need to deal with this virus in one way or another going forward. So, as we move to loosen some of the restrictions, certain groups, high-risk individual groups, those over 65, those with underlying medical conditions or immune compromise, they're going to still need to take many precautions for this, because they'll certainly be at risk still for acquiring it. So. We're going to have to just stay vigilant and follow what's happening in other jurisdictions, because we do need to anticipate other waves of this virus.
Have the Spartan cubes been validated yet, and how many does Manitoba have anyway?
They have not yet been completely validated. I don't know the exact number of them. Are the ones that are here right now are for this research for the validation, so they're not right now being used to enhance testing. They're just being validated, and I believe that sometime in mid-May we are expecting a shipment of more of the cubes.
Thank you, everyone. This concludes today's media briefing.
Thank you.
Thank you.